We are live. Good afternoon. This is the House Appropriations Committee. It is Wednesday, 2025. It's almost 2:30. We're running a little behind, but we appreciate your patience as we have the folks from Dale who are with us. And we were just trying to remember, have we introduced ourselves to you this session yet?
We did like an overview.
We did the one before. Okay. We have a lot of.
All look familiar to me. And even in the same seats.
Yeah,
I think
okay,
we're good.
okay, so we're good there. I just don't want to be rude and not introduce ourselves if we have.
Thank you.
So what, you introduce yourselves for the record and tell us about your budget.
Hi, I'm Dr. Bowen, Jill Bowen, Commissioner for Dale Department of Disabilities, Aging and Independent Living. And we have a number of people here in the room and also on screen.
Bill Kelly, Finance Director.
We'll be testifying, but in the room also. Do you want to introduce yourself?
Sure. Angela Smith James, Deputy. Overnight principal this time.
And online, we have Jen, do you want to introduce yourself, please?
Yeah, thank you. I'm Jennifer Garabedian. I'm Dale's Developmental Disability Services Division Director.
And Stuart.
Hi, everybody. I'm Stuart Scher, General Counsel for Dale.
Thank you. Okay. So we have lots of information from you, and we're certainly interested in hearing of what's working well, what your successes are, what your challenges are, if you're going to change some programs or expand them, and before we get into the ups and downs, just kind of that kind of review of how you're doing.
So we are prepared to walk you through testimony and to give you that exact view into the department.
Thank you.
So just to begin, the Department of Disabilities, Aging and Independent Living is responsible for managing services for older Vermonters and Vermonters of all ages with disabilities. This is codified in 33 VSA Chapter 5 of Vermont's Human Services Statute. The mission: to make Vermont the best state in which to grow old or live with a disability with dignity, respect, and independence. This guides the delivery of all of our services. Our vision is to enable older Vermonters and Vermonters with disabilities to receive supports and services in their homes, in their chosen communities, living independently and fully included as participating and contributing member of those communities. This is pretty critical. It's part of a system of care. It includes community services and choice. And the commitment is underlined by state and federal mandates. It includes this Age Strong Vermont Plan, and year one implementation report is now out, and you will be getting some information on that shortly. The Older Vermont Act, the Older Americans Act, the Americans with Disabilities Act, the Workforce Innovation Opportunity Act, Vermont Healthcare Administrative Rules, the Global Commitment to Health 1115 waiver, federal home and community-based rules, and the Olmstead decision. So Vermont remains a leader in supporting self-determination, choice, expansion of community-based options, the development of robust supported employment, mature worker options, and life-saving protective services. Our work does align with the governor's priorities to grow the economy, build the safest and healthiest communities. We embrace continuous performance improvement approaches, to ensure the highest quality services to Vermonters. And throughout this document, we will identify different ways in which we do that. For more information, we do have Dale Performance Budget Scorecard and Dale's Division Scorecards. And the testimony provides a link to those, as well as a summary of our performance measures by division and program at the end of testimony.
And you do not need to go through and read your entire piece, and just, sort of giving us the highlights will be.
Okay, so we will then jump to the highlights. Thank you.
You can read this at our leisure. Thank you.
Yes, if it was the summer, I'd say it's good beach reading. So,
You can all use the beach about now, I'm thinking.
okay, so I will jump now to department highlights. I will go through these, but then the big section where it kind of deep dives into many, many, many pages, there will be a very brief summary for that.
Okay.
So don't lose heart. Okay, so I want to jump to those accomplishments, which is on the bottom of page 4. So it's Age Strong Vermont Plan. We are pleased to report the continuing momentum of this extraordinary plan, multi-sector, multi-year plan, which was launched January 2024. So that's why we are at year 1 of implementation. And that report was just released. And there's an interactive community services finder map. There's goal trackers and a whole lot of information in there that gives you a view into our progress over year 1 on the objectives and goals of Vermont, the Age Strong Vermont Plan. The developmental disability services supported housing. We were really excited that in October of 2024, Riverflow Inc. opened their doors. It is an intentional supported housing community in Moncton, Vermont, and it came out of the Act 186 pilot grants that were awarded through Dale. The Developmental Disability Services Division Quality Assurance, DDSD, implemented an interim quality assurance process to ensure for an on-site quality review for each designated and specialized service agency, as well as the state supportive intermediary service organization. There's 5 new DDSD quality positions, which made the enhanced process possible. That was provided by the legislature. Thank you. The new process includes a monthly review of individuals engaged in services, affording DDSD quality staff the opportunity to perform standard quality assurance processes, interview individuals and guardians as appropriate, and connect with staff.
I had a question, I think Rep. Stevens had a question, maybe I waited too long.
Yes, it's fine. Just going back to that, to the housing that's opened, how many units is that? And that's part of, we just included $2.8 million for the project in Burlington. This is the first piece of those 3 units. Can you just spend a couple of minutes just describing the difference between this one and the 2 that are part of the pilot program?
So there's 3 recipients of the pilot grants, 4 programs that are coming out of that. Riverflow was the first one to open its doors. There's 4 individuals with complex developmental disabilities that reside at this house. It's a very nice space. I've been there and had an opportunity to meet with the staff, to meet with the individuals who are being served there. So they live there, and so do 2 staff live there. So there are 6 rooms, and then you walk into what feels very much like a house, and a really community. So that model, community connectedness model, the inclusion model, the staff being there, is what was stood up at Riverflow. Do you want to say how that compares to some of the other, Jen, when I go you? Jen, do you want to say how that compares to the other models that were part of the pilot program?
Yeah, sure. Thank you, Dr. Bowen. So Upper Valley Services has a project in Waterbury in partnership with the Downstreet Housing. And so that is apartment set aside, which will have service supported housing. So apartments for individuals with intellectual or developmental disabilities, and then services that support individuals to live there. With any level of disability. So it could be modest or moderate level of need, or more complex level of need, as Dr. Bowen has described, for individuals who are living in the river flow. But so that model can support a variety of levels of need. And then they have also Upper Valley Services is working in Randolph for converting a historic building to have a I think it's a 2-unit, and then some accessory dwellings, so up to 4 units ultimately. And that will have some service supported housing, and then more of a kind of the model that the River Flow has. So individuals living with service providers in the home as well. So kind of that community-based integration as well. And then the Champlain Housing Trust model, which I think is what you were referring to, Representative. They also have a service supported housing model. That apartment building is intended in its entirety to support individuals with intellectual and developmental disabilities, which is what sets itself apart from the Upper Valley Services model.
Thank you.
Thank you. And Rep, you had a question.
Thank you. I'm very excited to see these come, to life. And these are pilot programs. I'm just wondering what the plan is for rolling out more of this housing. We had testimony at one point during the BAA attesting to a very significant community statewide need.
Yes, so there is statewide need for housing across the board, and for Vermonters and those with developmental disabilities are no exception, right? They also, what we're looking for here is the new models. The pilot program is designing models that we need to see what's most effective, and also creating choice in the community. The developmental disabilities residential kind of program, it's not really residential, it's a community-based, is mostly shared living providers right now. And there's fewer and fewer shared living providers, so the models are incredibly important. There are other DS units planned. We are very much aware of the numbers of units that ultimately need to stand up, and are working towards that. There are somewhere like, I think it's 40 some odd programs at various levels or stages that have, I think it's 26 to 32 potential new units that may be able to come on. In addition to that, what has happened through this pilot, which was really a seeding pilot, right? It was seeding funding to help them get up, is that partnerships have been created. And they're really extensive partnerships with, housing trusts, anything from, more public to, right, private donors, and just a range of varied stakeholders. And they are helping to create the ability for the programs to expand. So Riverflow, for example, has already been working to get funding for the next one. I'm showing it like this because they have a lot of land, and the next one's going to be over here, and the next one's going to be over here. So they're already working through their model to duplicate the model and then triplicate the model and quadruplicate the model. And that's what we are hoping will happen with all of the pilot programs, is that the strategies that they employ to get the additional monies to operationalize their model can be replicated. Does that answer that question?
Sure. I think what I'm hearing you say is there is not additional money built into the budget to help continue to see some of these things. That is really the responsibility of the folks developing housing, supported housing.
So it's a sustainable model. There is resources that, like we have a housing coordinator that is funded through us, and some other ways in which we are helping to try and make those connections so that there is support for funding. But housing in general is in the governor's budget. So exactly how that will end up playing out is not, is not clear, but there's need for housing across the board. So what we're also looking for is, we paid close attention to people who have developmental disabilities that are, that maybe are experiencing housing insecurity or crisis, et cetera. So we will need to see how housing as a whole and where people with developmental disabilities can fit into that. But if you're saying, is there a specific plan or something in this for another round or another, that's not in this particular budget. Jen, did you want to add to that?
I would just also mention that the Agency of Human Services was awarded a housing accelerator grant. And while the term grant suggests funding associated with it, which it doesn't come with funding per se, but it does afford the state access to a subject matter expert, which will help pull together like a core contingency of local experts, as well as, again, access to a subject matter expert at a national level, sort of bring together available resources within our state and ensure that we are all working towards the same end goals and bring together sort of the voice of the department and our populations to the table to make sure that we are leveraging all of the available public and private partnerships to move these kinds of projects and the replicability of these projects to the forefront.
Yeah, I have to say Riverflow has been very, very successful and looks like some of these other programs too, in terms of their public-private partnerships. The accelerated grant is no small thing. It's competitive. We were very excited to get it. It was a collaborative effort through different parts of AHS. Dale is a lead on this, and many who do get an accelerator grant and then get all of this support and technical system, that tends to result in funding. So we are looking towards that and building those connections to be able to, turn that into potential fundability.
So Rep. LaRouche has a question on the screen. Go ahead, Wayne.
I was just curious, what's the total number of people, in the programs, or for whether it's housing or whatever? What's your population that you're dealing with on an annual basis?
Jen, do you want to take that?
Sure. So in developmental disability services, across all of the different programs that we have, we support about 4,500 individuals.
And that's just in the developmental disabilities area of your, yeah.
That's what the pilots were dedicated to, and the units that we're talking about that are in various levels of development and that we're hoping for expansion through these partnerships are focused on.
Yeah, great. So
Thanks.
you have a lot of highlights in here, and what are the highlights of the highlights? Because I know you'll be going to House Human Services, and they'll be going into more detail of all of this.
Okay. P2P is a program. We're also very pleased that our Department of Division of the Blind and Visually Impaired is the lead for the state. Multi-partner also focus on transitioning youth with various disabilities. So coming out of high school and connecting to work. Next page, I'll just mention Mission Care. We can discuss it further. It is the first complex care nursing home that has opened in Vermont, and it has been successful so far in moving 15 people many of whom were in situations where they were in beds for hundreds of days, like 400 days. The ones that came from psychiatric hospitals was 600 days. So if you've heard about beds that were blocked in the hospital system, this is helping to move them. Rutland said they can now open their ICU again. So the flow is happening. They are specialty because of the complex nature of these folks. They may have mental health issues in addition to meeting nursing home eligibility. They're all choices for care. They may have criminal justice challenges, but the kinds of skills that were needed that made it difficult for others to take them in. So it is moving. That's a highlight of the highlights.
Sure.
I'll keep moving to ones that I think particularly. The Adult Day Startup Grant on the following page. was granted to Central Vermont Council on Aging as the fiscal sponsor for Generations Vermont, an organization that's designing a new multi-generational adult day center and childcare center in Central Vermont. Very happy about that. The multi-generational approaches are really healthy. It's a win-win. So I just wanted to highlight that for you. The home delivered meals with the global commitment investment. Again, this is about extending Meals on Wheels and home delivery through Medicaid services. And it's
Remember, we asked last year to see if that could be done that way and we could extend it. So I'm so glad this worked out.
it has made a difference in many people's lives.
Yeah.
I'm gonna keep going. Payment reform after 6 years. This is now getting ready to roll. It's an implementation phase. It is really very much of a transformation in terms of how payment methodology works. And it is in the DS system, and it is goes hand in hand to some degree with the conflict free case management, which we will talk about when we get to the right. But it is something that will enable us to monitor and track and really have information about what services are provided to whom and when. So nursing facility rates, recruitment and retention grants. This is efforts to stabilize the nursing home, which costs are very, very high. The emergency fund relief. This is part of statutory requirements. And in addition to the rebates that will be happening this year, there were grants that were provided through legislature to help recruit LNAs and medical directors.
You were using a lot of traveling nurses.
Oh my goodness. Contract and traveling nurses, extremely expensive. LNAs are the backbone of the nursing home, and while RNs maybe in hospitals have stabilized a little bit, not the case for LNAs.
Okay.
I'm done with those highlights at super speed.
Thank you. We appreciate
Super
it.
speed as I could do it. And I'm at the page where I can just specifically speak about the one proposal that is in state fiscal year 26 for Dale, which is the mandatory federal conflict-free case management. It's been a multi-year project, and it is necessary to comply with mandatory federal regulations requiring conflict-free case management in home and community-based services. This has been well documented. This is not something that is new to folks. It's been working towards this. We do have a deadline for implementation in order to be in compliance with our approved plan of implementation with CMS. So the RFP for developing the case management, again, if people are not, maybe it's not on top of your head like it's on the top of my head, but it's to separate direct service and case management ultimately, because there's an inherent conflict in that, and it's required by
See that Rep. LaRouche has a question. Maybe.
Yes.
Chris, go ahead, Wayne.
Yeah, I would sort of like to fall back for a second to the Meals on Wheels for, looks like not very much money. Is that the entire program for, taking food to the elderly or disabled people? Is that the total cost?
Most of the money for Meals on Wheels comes through the Older Americans Act. So it's a separate federal grant. And there's approximately $10 million that comes through that way. The majority of it is for nutritional services like Meals on Wheels. And then there's approximately $6 million from the state that's also in there. So this was an extension to be able to stretch further.
So roughly 16 million. So I'm just wrapping my head around how much money we spend on, meals for kids and wrapping it around this. So I see there's more money than what I thought was there. Thanks.
Yeah, it was 1.3 additional on top of the 1 million. The legislature has been paying attention to that and really appreciate it. Yeah, so the mandatory conflict-free case management is for DS, also for choices for care. The area agencies and aging have been picking up the case management. There's an RFP that is finalized for the case management provider for DS. The total budget request that was in the governor's budget is 8.6 million, global commitment to cover the costs.
Yeah,
Yes, go ahead.
so that 8.6 million will cover this
Case
compliance
manage-
issue?
Yes.
Okay, so if I'm your service coordinator and I've helped line up a home provider for you and I'm visiting you once a month and I'm helping you address different issues that come up, how do we make sure that, and then there's a case manager separate from this, who I guess is a second set of eyes.
Different functions.
Can you explain how it's a different function?
Yeah.
And
Jen, do you want to do
not
that?
duplication?
Yeah, it's not duplication. It is quite different. She'll just be better at explaining it than I.
Mhm.
Go ahead.
A lot of faith in me. Yeah, that's a great question. Thanks, Rep. Jacoboni. So the case management functions are very specific roles and responsibilities related to person-centered planning, assuring that assessments are performed, helping the individual develop their individual service agreement, working with an individual, their guardian, their family to determine the services that they're looking for and to advise where they can get services, so options counseling. A direct service provider, so the designated agency and the specialized services agency, they have the responsibility of program management. So in the future state, after October 1st, service coordinator, those case management functions will move to the independent case management entity, and what will remain are service coordination. And so the things like overseeing a shared living provider, making sure that direct services occur and are overseen and managed appropriately, all of those functions will remain. It was, sort of determined to be a pretty significant amount of work still, obviously. And so those functions remain. They'll no longer be called service coordination. They'll no longer be billed or encountered through the agency in the same way, but are pretty separate and distinct roles and responsibilities. So are not considered duplicative through the Centers for Medicare and Medicaid, and will work with the agencies to make sure that those things are not overlapping, but would still remain the service coordinator can evolve to a program coordinator. The same individual that was supporting someone can remain at the agency. And so,
And what do you anticipate the caseload ratio to be? If I'm a case manager, how many clients would I be responsible for?
Yeah, so we put that into our request for proposals. So based on the level of need, we laid out some pretty specific expectations, knowing that there would be a blend and that likely a case manager's caseload would be made up of a variety of individuals and a person, like a variety of needs. We expect that case managers will have caseloads on average of 32 individuals. While that is significantly higher than what we see in service coordination now, it is still pretty significantly lower than the national average of case managers. What we've heard is across the country, case managers often have caseloads upwards to 100. And so having a caseload that is set around 32 is significantly lower and should allow for pretty high quality case management.
Thank you.
So that is our proposal for Dale for state fiscal year 26. And I am just going to do that very quick overview and skip all the rest of those pages until we get to the numbers. So,
Which page we should be looking at?
well, this is I'm going to give you just a summary, but it's for pages 10 through whatever that last one is, like 40. 10 through 40 is basically a breakdown, it's a drill down of each division.
Okay.
It gives you a lot of detail about what's happening in those divisions. What I did when I read through what seemed like a lot, that was actually some of our highlights. There's a lot of activity going on. Yes, you do a lot of work.
We appreciate that.
And it crosses, it's wider range of things, I think, than people may think, but I'm going to just say. So the Adult Services Division, responsible for managing a full array of long-term services and supports, which we call, long-term services and supports, LTSS, for older Vermonters and adults with physical disabilities. Vermont Medicaid, the Federal Older Americans Act, and state general funds are the primary sources of funds for these services. And ASD, or the Adult Services Division, primary partners include the area agencies on aging, the designated and specialized service agencies, the home health agencies, the adult day centers, SASH, and long-term care facilities. So it's a whole system of care. We think of it in terms of like a triangle. You might have a public health triangle. So together with our community partners, ASD served thousands of Vermonters in state fiscal year 24. Some highlights include more than 48,500 people who received a variety of Older Americans Act services, including Meals on Wheels. Just under 8,700 people received home delivered meals, as I was saying. 6,663 received choices for care services across all settings. 4,755 received SASH services, and 374 participated in adult day programs. So that's the Adult Services Division with some of the reach numbers. The Developmental Disability Services Division supports people to live, work, and participate as integrated citizens in their local communities, pursuing their own choices, goals, aspirations, and preferences. The division plans, coordinates, administers, monitors, and evaluates state and federally funded services for people with developmental disabilities and their families within Vermont. Services are individualized to address the goals, capacity, needs, and values of each person. DDSD provides funding for services, systems planning, technical assistance, training, quality assurance, program monitoring, and standards compliance. Also provides court-ordered public guardianship to adults with developmental disabilities and older Vermonters age 60 and over on behalf of the commissioner. So this is the Office of Public Guardians. Okay, by the numbers, 3,394 people were served in home and community-based services. Over 1,000 served by flexible family funding. Nearly 650 served by family managed respite. 460 served in bridge program. 750 received Office of Public guardianship services, and 328 received Office of Public Guardian representative payee services. The next division is the Division for the Blind and Visually Impaired, who assist individuals who are blind or visually impaired to meet their employment and independence goals by obtaining livable wage jobs and income. They provide training to improve employment skills, higher education that leads to degrees or certificates. They help transition high school students from school to the work world. And helps individuals of all ages to build adaptive skills related to their visual impairment through assistive technology, low vision, orientation and mobility, and independent living skills. By the numbers, over 1,163 are served. Were served. Total training hours is 2,344. Next is the Division of Licensing and Protection. The Division of Licensing and Protection is a division under Dale. There are two branches that work to protect vulnerable adults and individuals receiving care. That's survey and certification, which is the licensing and certificate for the healthcare organizations so that they meet, ensuring that they meet minimum state and federal regulatory compliance. In addition to survey and certification, the Adult Protective Services is the other arm of the Division of Licensing and Protection, and that's APS, or the Adult Protective Services. APS investigates allegations of abuse, neglect, and exploitation of vulnerable adults and implements protective services as necessary to limit future maltreatment. Survey and certification conducted 266 on-site investigations at nearly 500 combined complaints and self-reports across all state and federal provider groups. APS, Adult Protective Services, received nearly 4,000 reports alleging abuse, neglect, or exploitation of vulnerable adults. And APS included 402 investigations and 424 assessments, to give you an idea of the breadth of the work. Hireability, which is the Division of Vocational Rehabilitation, and the mission there is to help Vermonters with disabilities prepare for, obtain, and maintain meaningful careers, and to help employers recruit, train, and retain employees with disabilities. Hireability serves people who face barriers to employment, help participants figure out the type of career pathways, and provide employers with a workforce that has the skills that are needed. By the numbers, 6,734 individuals served in state fiscal year 24, which is an increase year over year. More than 6,000 people were served in the core hireability program, and nearly 6,000 served, which is again an increase from the previous year. And nearly 1,600 high school students served through the pre-employment transition services program, which is also an increase over the previous year. The difference in the lives of the high school students is, I mean, they give testimonials about quite something. Recent successes, I think we went through in our highlights. They're pretty much our success. I pulled out as highlights what were our successes.
Mhm.
And then we have important ongoing work, which were also in the highlights. So that brings us to the numbers. Do you have any questions? I know I went through fast, but
It's great. I actually met somebody who was going through your hireability program and is working in a community organization in Middlebury and is thriving. And it's very exciting to see somebody who was so successful going through the program. So,
I went through it very, very fast, but I'll just say that hireability actually was awarded opioid settlement dollars to continue their work that they're doing with folks who are in recovery from opioid use disorder to connect them to jobs. And it's quite effective. They've had a lot of success.
that's great. Rebecca Cavoni has a question.
Just briefly, adult day services. I'm hearing from our adult day programs that because of the high rate of absenteeism, folks who are not well, they can't come in that day, and the weather can be intimidating, et cetera, that they can't bill. So consequently, it's destabilizing them financially. And the conversation moved to, I wondered if by looking at the numbers, you must budget so much a year and they're coming in at X, a lower amount. If that's so, could the rate be adjusted so we maximize Medicaid, but it make up for some of that lost time to keep the capacity in place? Have you had any of those kinds of conversations?
We've had some of those conversations, and that the absenteeism or the no-shows create a challenge. I don't know if you have any further information on that right now, Angela?
I would just add that, what a lot of adult days try to do to ensure that they're all can be at higher capacity is they have, upwards of, if they have 100 people enrolled in the program, they'll have about 30 people come on any given day, so that if someone doesn't show up, then another person could potentially take that spot. Often, if it's a weather-related event, you can't get someone else to come that quickly, but if it's an illness where someone's gonna be out for a week, you may be able to call another participant on your list to have them come. So there's ways that, agencies try to address that. In addition, the rate increase that was given, following the rate study was above what was really recommended in the rate study, and was partly why it was above was, to try to provide some of that stabilization given the absenteeism.
Thank you.
So now I'm on page 41. So I'll walk through the numbers. The state fiscal year 2026 total Dale proposed budget is 783,521,821. That is divided, 4.6% of that comes from the general fund. 88.8% comes from global commitment, Medicaid waiver. 6.2% is federal fund other than global commitment, and 1% is special and interdepartmental funds, less than 1%. So I will go into this by division. So the Developmental Disability Services Division, the proposed budget total is 353,407,236. That's 45% of the total budget. You can see the general fund and global commitment split. It's a heavily global commitment at 97%. And then the federal other at 1%. The Adult Services Division, 378,590,741. That is 48% of the total budget. Again, heavily global commitment at 93%, with 3% general fund, 4% federal other. Vocational rehabilitation, which is higher ability, 31,761,678, which is 4% of the total budget. Here you'll see a general fund of 23%. There's no global commitment, and the federal dollars that flow through come through other grants, and that's 7% of higher abilities funds. Blind and visually impaired, $5,755,177, which is 1% of the total budget. 18% is general fund, is 5% of global commitment, and then 77% of the federal or other. Much of that is the P2P, or the Pathways Partnership, that I mentioned earlier. Licensing and protection, $7,086,263, also approximately 1% of the total budget. 51% of which is general fund. None is global commitment. 49% are other funds that support APS and survey and certification. Commissioner's office is $6,920,726, which is 1%, 78% of which is general fund, 2% from global commitment, and 20% from other federal dollars, which brings us back to the total $783,521,821. There are no questions. The following page is a summary of changes from last year's base budget to this year's proposed budget.
And we don't need to talk about salary and fringe and collective bargaining. They're just kind of are what they are everywhere. So if you have any particular new initiatives that you want to highlight, we don't need to go through the salary piece.
Okay, so we will, so number 2 on there is conflict-free case management. So you're going to see that in a couple of different places, which will ultimately add up to the 8.6.
Yeah.
Okay, so this piece of it is the 5 new positions, 3 ASD quality and program participant specialists, and 2 DS data analysts, which will do the eligibility determination. And the costs of that is $1,289,000. The next is we go down to Adult Services Division. We don't have anything other than, salaries collected, right? Okay. Blind, visually impaired. You just see here that Pathways to Partnership grant 1,500,000, okay. Vocational rehabilitation, with higher ability, there's just a budget neutral fund transfer. To move administrative into general fund. It's just a switch. It's in where it sits, okay. Developmental services grants appropriation. Okay, so here you're seeing a big chunk of that 8.6. It's the $5,842,315 dollars for conflict-free case management as for the developmental services division. We also have a DS caseload increase, so it's $5,390,045 for that. We have an increase in our Public Safety Act 248 caseload. And Act 248 are the folks who are committed to the custody of the commissioner after being found not fit to proceed in a criminal matter that was had some seriousness associated with. Okay, you're familiar with that. Okay. The budget to actuals alignment actually is an offset, and that had to do with people being budgeted for who actually didn't come on a full year. So there's a, okay.
Like a vacancy savings.
Yeah, okay. Commercial policy workers' comp premium decrease is just, I think what was that? The 66,000 for the policy workers' comp?
Yeah, it's like an internal service fund. We're just given the cost and it actually went down.
Okay, wow. Okay, it's just like,
We'll take it.
and I know that was explained to me before, but I'm like, oh, okay. Brain injury program, traumatic brain injury, TBI, utilization increase of 350,000. Again, conflict-free case management applies to that program as well. So that's where the 183,466. We'll skip over that next one. And then for choices for care, you have the statutory nursing home inflationary increase. Yes, so it is a lot. It's a statutory, this is the rebasing.
Yep.
Okay, that happens every 2 years. And this is statutorily.
Do you think this will help? Because we're giving 21 million in EFR funds. Should that be reduced in the future as a result of this, you think?
We do believe that this will stabilize because the extraordinary funding request, the last time there was the statutory rebasing, there's always a lag. So the last time it was done, it was based on fiscal year 21 realities.
Yeah.
Which at that point, we're right in the middle of the pandemic, and the costs were lower because there was so many fewer. So there was just more of a gap between what their actual costs were and what the rebase brought to them. This year, since it's based on fiscal year 23's reality, that's on this side of the pandemic, and it'll be closer to the reality of their current costs. Will it eliminate extraordinary funding requests? I can't say that.
I hope it will reduce.
But it should reduce it. It should help to stabilize the nursing home. And then you can just see that there's also a big bed day utilization as there's increased need for nursing home beds.
And we put 24 million in a budget adjustment as well for almost 78,000 more bed days.
Right.
So is this like another 78,000 bed days on top of those 78,000?
No, this is annualizing the BA.
Analyzing the other one, okay.
Exactly. And then again, you'll see the conflict-free case management come up here in choices of care for 1,329,101. And then there's the regular veterans home projected costs on the settlement at 3,914,481.
And that hopefully is the veterans home that would normally come in budget adjustment, and now we're going to see it here.
That's the
plan. I know.
Yes.
Great.
So that's our recommendations for the changes from last year. All right, and then you've got drill down. I just want to bring, details if you will, for your, again, reading pleasure. From page 46 on is a really nice way to see more about what we do and what the costs are associated with it. And also, I think importantly, the performance measures are right there. So, and I know there was request for that. Yeah. So there you have it, and that goes for several pages because, we have a lot of programs. Our folks are amazing. They work really hard as long as we've got that. I want to say that out loud. Yeah. And then that goes to page 64. And then the only thing really left is the organizational chart. And that's us.
Quite an impressive array of activities that you all do. It's something else.
This is not my budget.
We are very glad that Representative Yakuboni has this budget. He's familiar with it.
It is
Very
nicely
great.
laid out.
Nicely all ties in together.
Yeah, and so he's our expert. We're
Happy
delighted.
to have him be our liaison.
Yes, well, we're all happy then. Yes, it's great. So we will funnel committee our questions through Dave. And we really appreciate you all coming in here and on the screen and telling us about all the great things you do. So
So
have
much.
a lot of territory and serve a lot of people with a lot of different kinds of needs, so. Okay, thank you so much.
Okay, you all have a good day.
Okay.
Thank you.
Really, our website's down, the General Assembly website's down, but I think that we're done for the day. And so Erin has been trying to, she's been doing heroic work to try to get us somebody to come tomorrow, and I actually texted the Commissioner of Finance and said, we are having trouble finding people coming in. And at this point, he did, and then they said they weren't ready. So you don't have vacation. It's time to work on your budget, read the rest of the language, work on your budget areas. I know some of you have been having meetings. We are on the floor with budget adjustment tomorrow afternoon at 3. We'll be probably the only bill that's on the floor. So be prepared for me to yield to you if there are questions that folks have. I have no idea. I mean, we've all talked about it in our caucuses and we've talked about it with people in various places. So we probably have a good idea what the questions are, but you just never know what's happening for. So, and I'm going to go finish writing my floor report.
We could
Thank you.
wake up tomorrow morning, find the full schedule.
Check the agenda. We won't start before 9 if we've got something, but maybe we should just check in with each other at 9 tomorrow morning and just pop in and we'll see where we are.
Are you getting any questions from your budget buddies?
No.
Have you reached out to everybody? Okay. Send a note.
You saw I sent something to the entire body. So.
We did, and I forwarded that to my group.
Great.
Again, because it had all the links.
Yeah.
Or
The
attachments.
attachments, yeah.
And just said, you're stuck with me, so.
And they haven't responded.
Oh, that's right. I can't understand why.
Great. All right. Well, so we'll just check in tomorrow morning at 9 and see if we need to go live and if we have anything. Otherwise,